the chairperson, Dr. Goel. Well, not only that, even I have got an opportunity. I am very grateful to the organizers of this third international conference, which has been collaboratively organized by various bodies, Rajiv Gandhi Hospital, RML, the Delhi University, and the Care. And I'm sure they have come a long way from the first international conference. As I was listening to my previous speakers, many things have been covered up. Probably that will make my job little easier. Maybe we can continue, but my focus is going to be on oncology nursing with the topic of coming of age. That means from the India's perspective. That's where I'm going to be focusing on. Just to review a quick this thing to go through, that we all know it, since morning you must have been listening to this, that the cancer by 2050, and the other day I was reading by 2030, it's going to be an epidemic, and particularly in the developing world. So we can see that it ranks second as cause of death in the developed world, and it is a fourth killer disease in our country, as per information from what we have received from various registries. Now, what is cancer cure? If you see on that, cure which needs to be stressed, attitudes needs to be positive, nursing being effective, care being total, education should be comprehensive for the oncology nurses, and research being applied. That's an upcoming field in the country, and more nurses are getting interested in exploring various areas to add the new information by means of the cancer research. And care, we have heard before, two of them telling us how to communicate, and of course, Smriti just told us that how to break the bad news. It is, we have to learn even that as an art, and nursing is an art. Awareness and adaptability to the situation, to various patients. Rehabilitation and reassurance is very important for our cancer patients because if you reflect on the previous slides, which they said was the tertiary prevention, and that speaks of the rehabilitation. And reassurance all the time, because I think if you call back, always think of cancer is like any other disease, not a sentence. Now, what is a sentence? It's not a death sentence anymore to be thought of. That reassurance from day one, your patients are yours. And this is, I think, one of the speakers was emphasizing that adapt them, take them from at any angle, whether it is the hospitalization or whether it is to be taken care in inpatient, outpatient units. Education and evaluation. If we continue, what are the major challenges in the cancer care? Continued rise in the population, and we know it, the cancer increases with more of the age and exposure to carcinogens. There is a radical alteration in the traditional family structure. We know it, and where it is important is to take care, because it's a long-term illness. The support system is very important. And growing emphasis on individuals' right in making the decision. I think you heard that give choices to the patient, alternatives available, and involve the patient or the family care. So what is the art of cancer care? This is one of the European saying of 15th century, and I think it conveys a lot of meaning. To sometimes care, often relieve, and always comfort, for our cancer patients that we have to keep in mind. There are 3 C's here that a nurse has to always see that she's making use of these, that is compassion. I think with the reassurance and the patients of the cancer, compassion is the upmost, the empathy, empathetical approach which we talk about, concern about the patient and the family, and consideration in helping them to give the hope, and the realistic hope, not the hope कि सब कुछ ठीक हो जाएगा. You have to be very, very realistic when you are talking. That's your interaction which goes on. And further to say on this thing, what kind of behavior competencies a cancer nurse should be able to develop in her traits, in her personality. Well, on the right, if we say biophysical and psychological, we know about it. That's the knowledge that we are having. But on the left, if you think over, you have seen that empathy right from the day one we enter into the nursing. I'm sure our nursing teachers in the first years, they start drilling in us, and I think that's very, very important. Proficiency, of course, the competency, hope in this particularly, and any patient, but much more with the cancer patients which you have. Constancy means the perseverance, the constantly going on, discussing with them. Many a times they ask you, number of times, is it me? Or you think I heard it rightly, that this is what I've been diagnosed with? What am I going to do? Am I going to get, will I be okay? So don't think of, you say, how many times I have explained you. You have to develop that patience and repeat the information to them. And intimacy, of course, a professional intimacy which you need to develop with your patients. Like speaker before me said, professional attachment. You have the attachment, have the detachment, but there is a professional attachment with your patients. Cancer patients are yours from the day one till they live. I think keep that in mind. What are changing roles? I think nurse in any situation is advocate, counselor, planner, coordinator, caregiver, thinker, and a change agent for them. So now I will say that our shifting of the nursing, the not only in the oncology, I think in every sphere, the shift is from cure to care. And care is the most important ingredient for your cancer patients, right? And in future, the nurses will become the strong, powerful decision makers and competent care providers, because not many patients all the time will be living in the hospital. They are in and out of the hospital, the cancer patients, where you will have to see that your referral with the community and approach interaction to see with the caregivers at home how we are going to be handling these type of situations. So what is the change? The change is there is a limit to cure, but there is no limit to care. Please keep that in mind always. Cure has a limit, whether your cancer patients also going through the treatment of adjuvant modalities, surgery, chemo, the radio and all those, but the care has no limit. You can see that now today how much we talk about the palliative care for these patients, that we need to really work in the quality of life for them. So what kind of a role transition is coming for the nurses? Emphasis should be on primary and secondary prevention. They should help in caregiving with the other health team members as well as friends and the family. Now some of the characteristics I would try to bring out over here from the caregiver, care receiver, healthcare delivery system, and the family and the environment that we talk about. The caregiver must have the knowledge. Now here I'm referring to the nurse as a caregiver. She must have skill in various methods of detection, screening, health education, etc., and participation in the preventive programs. Care receiver, these factors we have to keep in mind, how we individualize the care to the people based on their age, sex, religion, ethnicity, economic status, experience with the cancer or contact with cancer patients. Because they might have come in contact with the cancer patients who might have been treated and got cured, who might not have cured, they might have had some problems. All that will make a difference of how he takes or she takes her diagnosis and the treatment. How about the healthcare system? Now in the caregiver, I have already given you. If you are the support system, the caregiving support program which we have to make, and what is the nature of the giving, they are all interactive, not one. They don't work in isolation. Outcomes of the caregiving will be again for the caregiver. You see, even a caregiver looks to the outcomes. How is my patient progressing? What is the changes which have come in my patient? Same thing from the point of view from the care receiver and also from the healthcare delivery system. Now, if you talk about the healthcare delivery system here, I'm just emphasizing on, particularly on the caregiving support program, which we should have. We must integrate this into our healthcare delivery system. So what about the family involved or the environment in the caregiving? We as caregivers, we must try to analyze the situation, particularly family relationship. What is the support system of the family? The cohesion, the conflicts in the family, how do they express with each other, and what support is being given to the patient here? How about the environment? Where have they been exposed to? Education, we know it now that so much of not only the healthcare professionals give the education, patient himself or herself educates through the internet. Today so much of material is available, but a caution has to be given to them that how much will they be able to absorb depending on the level of the patients what they are good, not to get a wrong information or which is very pessimistic for them. Mass media exposure, advice from the doctor, nurse, healthcare professionals, they all count. For the caregiver, the amount of this lifestyle change, has the patient been able to change, bring about some behavior modification in the life? What is the caregiver's role strain? Please keep that in mind. Even a caregiver has got a strain and a stress in taking care of long-term illness patients. It's not like an intensive care unit where rewards are immediate, as you are able to take care and immediately able to see. These are the patients which is you have a long-term disorder in which we will be able to take, and that's where caregiving role experience is very important. You have to be clear about your own role conflict. Have a positive attitude and not be optimistic and not the pessimistic. You can't do anything. I think something can be done for every cancer patient. And sometimes lack of resources, of course, put a strain on the caregiver. So what do we have to prepare ourselves? And what will be the rewards of this one? As I told you, it is not an intensive care unit or critical care unit where rewards are immediate, that your patient has responded quickly and you are able to observe and see. Here it is the learning about your patient, learning about yourself increasing, giving meaning to life, the quality of life, and developing a self-confidence with an optimistic attitude. Of course, if you have that, you will have satisfaction with your healthcare delivery system. Your own self-concept will also be enhanced. What about the care receiver? He has a satisfaction. If you are able to understand, plan the care, and make the constant approach with them and reassure them, they have satisfaction with the caregiver. Because of early detection and quality of life, we are able to enhance. They would also have satisfaction with the healthcare delivery system, that here the people understand the facilities are available for me to take care of myself or my family members, right? And for the family, they have a better support. There will be less conflict. The conflicts will be resolved. Openness will be there in the family. They will be able to discuss if you give and talk to them in a reality, like she said, breaking the news. I think that is in a way to understand the family and the patient, how we are going to involve them in the care. And family self-care role will also be enhanced, giving them importance and telling them it is very, very important for you to see, because we need to pay attention to the family caregiver also, whoever is the person. They also have a stress and strain, not only physical, they will have economical also, the stress and strain of the long-term treatment that we have. Now in the forthcoming scenario, just to go through it quickly, because as the decades will go, as I said, cancer is going to assume a very epidemic type of a position. While health professionals has to be adequately and appropriately educated at all the levels, community facilities also have to be provided. And that is where comes the role of the hospice in the care of the cancer patients. Cancer is a thing to tackle at its earliest manifestation to reduce the cost, suffering, agony and misery. Who will do it? Now the various questions arise. Do we need the people's movement? Do we need more cancer detection centers? Do we need more hospices for continuing care? Do we need still more investigation centers? Do we need the community perception and participation at its best? Yes, we need all these and much more. The answer to all my questions posed is yes, we need all these and much more. Education is the best vaccine to detect and treat, and that is where primary prevention, emphasis, change of lifestyles, and these things need to be emphasized, and nurses must be involved in this in a very active way. Cancer hospitals provide the specialized care, know the resources, the comprehensive care and the therapy is available, very, very important, right from the primary prevention to your tertiary prevention. How long we have come up to today with the oncology nursing education that we have. We know it. We have oncology nursing courses at the postgraduate level. MSc nursing in the oncology nursing is offered in number of number of colleges of nursing in the country. And post-basic diploma in oncology nursing, these are the courses which have been prepared and approved by the Indian Nursing Council. These are 10 months or 1 academic year courses which are available, and oncology nursing is available. There may be many more. I think to the best of my knowledge, which I know about, is the Tata Memorial Hospital in Mumbai and Dharamshila Cancer Institute in Delhi. They have the full-fledged 1-year clinical specialty courses after the basic nursing, whether it is a diploma program or a BSc program. I was talking about it, the cancer research, nursing, particularly by the nurses, which there is a lot of opportunity. More nurses are showing keen interest, but yes, still it is major percentage is still only limited to the academic programs as a prerequisite to the university degrees at the MSc or the postgraduate program which we are having. More and more clinical practicing nurses should take up some small areas like operational research in the oncology nursing in the hospital settings, community setting, which should be done. Why? Because this would help us to generate the valid information and base our nursing practice decisions. Research-related roles of the nurses conducting research. You may be conducting research, you may be participating in research with other healthcare professionals. You will be a consumer of the research findings and utilizing them, facilitator and contributor. So there are different roles even here of the nurse in what ways she can contribute to the cancer nursing research. Then today is an era of specialization, and I think this does bring in empowerment in the nurses. I just talked about the clinical specialty courses and the postgraduate oncology nursing courses. I think that is a step towards empowerment of the nurses in becoming autonomous and independent nurse practitioners in the care of the patients. So it will help us in quality health care. It will raise the standards of nursing education and practice. This will be cost effective in a way that that nurse who plans the care, she knows very well about the patient and the family and care. Autonomy to the nursing, expansion of legal scope of practice within the legal framework that we need to practice on. It helps in building career ladder, and when the career ladder is built up, this should be linked up with the remuneration, and of course it will enhance the professional status and the images, and it will help in recruitment and retention of the nurses because the job satisfaction, I presume, would be there if we are empowered with the specialization. What is the scope of specialization? I have already mentioned. But then coming up to the talking on, there is another area which is building up, it has come up, is palliative care. As I just reflect to my previous slide where I had said, there is limit to care, but there is no limit for care. So what is palliative care? That you put life in their days, not just days into the life. That is the quality of the life which is very important. It never says, in this one, never says there is nothing we can do. We can always do something with our long-term cancer patients which we have in the hospices and even in homes giving the palliative care. What is the need today and the challenge now for the oncology nurse? It's a concern of each cancer nurse because it enhances cure, hope, and the hope of care. It helps in providing quality care to the cancer patients, and it is a rewarding challenge in a different way of your rewarding challenge, where you are able to really sustain and provide the care to these patients on the long-term basis. Focus on the optimal level of function for the patients as well as the family. Both of them you will have to keep in mind. I'll just quote it by Donoran and Pierce when they said, "Something can be done for cancer patients. We should not feel useless or helpless or even hopelessly feeling just because every patient is not cured. Yes, there is a limit of cure depending on the stage on which the patient has come to the healthcare facility. That is why more and more emphasis is on the prevention and screening today that we want to focus, and the nurses should actively participate into that. But something can always be done." One of the pioneer nurse, Virginia Henderson, she said, within quotes, "When nurses' sensitivity to human needs is joined with the ability to find and use expert opinion with reported research," you can see on that was way back in 1950s. I'm not talking of today. She's one of the pioneer nurse. If you have seen it, Foundations of Nursing, she's the one. She has given us basics of the nursing. Even that time she had said, we have got only one dependent role. All the other 6 roles are independent for the nurses. And that is where I thought I would reinforce here, or this thing, that she says, with reported research and apply it to their scientific method of investigation, there is no limit to the influence they might have on the healthcare worldwide. They here is the nurses, that they can make an influence on the healthcare worldwide. So I think it still remains true. Much more it is enriched, and we should be able to carry forward this legacy as the oncology nurses. I would like the nurses here or elsewhere, wherever they are, please spread the message. Cancer can be controlled if detected at the earliest sign. And this, I think, we have had the extensive sessions where we have heard about it. Cancer can be avoided if care is taken in time, that is preventive, primary prevention. Can be prevented if lifestyles are modified. Can be treated if diagnosed in time, that is your secondary prevention. And look for the cardinal pointers. Thank you. In the nutshell, I try to give you what is oncology nursing today and how it is evolved or it is evolving, with the hope in the future that we will have more active role as oncology nurses. Because don't only limit yourself to only to cancer care settings. I think every nurse in her life encounters a cancer patient, maybe in home, maybe in the community, maybe even in the intensive care units when you are working over there, you might come across. Even at that time when the patient is in a situation to listen, impart the education to the patient. You can be a real good change agent. Thank you.